Hi there, my name is Dr. Malie Coyne and I'm a clinical psychologist, and I'm delighted to be doing a talk for you called A Compassionate Approach to Managing Your Eating Distress and Promoting Healthy Body Image for Galway Public Libraries. So I'm a clinical psychologist. I'm also author of the book Love In, Love Out, A Compassionate Approach to Parenting Your Anxious Child, and I'm a lecturer in NUI Galway. I'm really delighted to be here, and I'm grateful to have the opportunity to speak about something that's really important to me. There has been a big rise in eating distress and eating issues during the pandemic, and it has always been an issue, but more so now. And also I have personal experience of having gone through an eating disorder when I was younger, and I work with people who have issues with eating. So I thought it was important for me to talk to you about what it's like, how you can help yourself. This talk is aimed more towards people who are 16 and older. However, I will be answering a question for parents at the end, and a lot of the information we talk about is very relevant for parents, and it's also relevant if you are a friend or family member of somebody who you're concerned about. So I think it has a lot of relevance for many people. And thank you so much for being here and for listening. Obviously, there's my book, Love In, A Compassionate Approach to Parenting Your Anxious Child, which is a book for parents of children with any type of difficulty, emotional difficulty, anxiety being one of them, because we all experience anxiety sometimes. So I'll just get into the talk. The overview is that we're going to be talking about why now, why are we having this talk, why did Galway Public Libraries ask me to do this, what type of eating disorders are there, common myths around it, early signs to look out for, how to support young people and families, and also I'd like to have a section on promoting healthy body image. I was going to write positive body image, but I've changed it because I think it's more about being healthy rather than being necessarily positive, because it's hard to be positive about our bodies all the time. I think if we focus on health and on what our bodies can do for us, and I think that's a kind of a better focus, really. So what eating disorders are not? Eating disorders are not a diet or a lifestyle choice. It is not vanity or a desire to be beautiful. And I really need to emphasize this with you because I think people have this idea that it's just about food, that it's about, you know, the influence of social media. And yes, there's definitely an influence of social media. In a way, I'm glad when I was a teenager I didn't have social media to contend with, but I was comparing myself a lot to other teens and other people out there. But I think social media has probably magnified a problem that was already there, because we're more able to compare ourselves to others. There's many filters on social media, which, you know, if we want, can make us look a certain way. Some very worrying filters I find as a parent, because I have two daughters aged 8 and 10, and it worries me that you can make yourself look thinner, or that you can make your change your body shape or change the way you look. That does concern me, as does kind of, more emphasis on people taking selfies. Not that selfies are bad to take, but a lot of accounts out there are very self-focused. And I think sometimes maybe we can lose the focus on what's important in life, which is what's inside, as opposed to how we look all the time. And that is something that concerns me. But social media on its own does not cause eating disorders. And I need to be really clear on that. Eating disorders are caused by a complexity of different issues. For me, there was an awful lot going on underneath the restriction of food and the over-exercise. And it wasn't just something like a faddy diet. The fact is that eating disorders are complex disorders, and there is never just one factor at play. Understanding this is crucial to support and recovery. So there is a genetic element, and we will talk about that in a second. But I suppose it's and also there's many other factors involved, and I think it's just important for us to know that, so that, you know, that's kind of the basis of what we need to know. So what is an eating disorder? It's a serious and complex psychological psychiatric illness which has significant medical and psychological consequences. Now we are talking, I titled my talk Eating Distress. We're also talking about eating disorders. So there's kind of like a spectrum that we're covering today. But if we're looking at eating disorders, you know, where you're diagnosed with an eating disorder, it's a serious and complex psychological psychiatric illness which has significant medical and psychological consequences. Eating disorders have the highest mortality rates among psychiatric illnesses, especially anorexia. Really, like, it's not, that's why I kind of, you know, for people that might kind of underemphasize the severity of it, they can be very serious. And they can get serious quite quickly as well. It's not that, you know, it's not that it's like, you know, like, okay, obviously a gradual onset is the more common kind of way that it goes, but it can also happen quite rapidly if a person goes through something that's very traumatic for them and or they're having particular difficulties. Eating disorders are a coping mechanism which makes it really difficult and scary for the person to let go of. For me, the scariest thing was for somebody to say, I notice, you know, that why aren't you eating anymore? How come you've lost all that weight? You know, like that for me, it was my coping. I didn't want to let it go. So it's really scary for somebody, even for somebody listening to this today who feels that they might have issues with their eating. And many of us have issues with eating on a kind of, on a spectrum, and we'll talk about that in a second, but it can be scary when it becomes your way of controlling your environment. It becomes your coping mechanism. It can be very, very scary indeed. Yeah, I suppose understanding that an eating disorder is a person's coping mechanism helps those around the person realize how frightening and difficult it is for the person to let it go. And it's also a solution for a person who has an unregulated nervous system. It's a way to regulate your emotions, to cut off feelings like sadness, shame, or anger. It's a powerful distraction and focus that takes away from any capacity to focus on what's really going on for that person. So that's important to know. There is a cycle that some people might mention that may start with negative feelings about self or low self-esteem. Then you might have restriction of food or control of eating. The rules then might get a bit too hard. You might feel then a loss of control, which might lead to overeating, craving food, feeling like a failure, and on goes the cycle again. And that's, you know, that's kind of can be something that's, you know, important to know. I suppose for my own eating disorder, I felt like it was a military regime where my mind was the dictator, and my whole everyday life during the time that I was affected was impacted, was kind of, I just couldn't stop thinking about not eating and exercising, really. So like it was just something that just consumed my life. It was like something I felt like I had no control over. So the spectrum of eating behavior, I think it's important for us to know that there is a spectrum, and like there is an awful lot of focus on food and eating and, you know, everything on social media that talks about it, and just generally speaking. So somebody who practices intuitive eating is somebody who eats when they're hungry, views eating as pleasurable, eats intentionally with purpose when they're hungry, for instance, you know, stops eating when satisfied. They have a more positive body image. Again, I'm going to say healthy body image there. Includes a variety of healthy foods, allows for indulgences. It's okay to indulge. Does not regulate their emotions through food. Active for health and enjoyment. Now, sometimes we all can regulate our emotions through food a little bit. Do you know, like I think we all sometimes have a tendency, maybe when we're feeling sick or when we're feeling low, that we might kind of permit ourselves more to have, you know, that chocolate bar or whatever else, or when we're excited, you know, we might use food, or we might, you know, it can be emotionally based, but on the most part, if, somebody has intuitive eating, they're mostly eating when they're hungry. Yes, they're having indulgences sometimes, but it's more so, and they enjoy food. They enjoy going to a restaurant. They enjoy the array of food. They have their favorite foods. They have foods they don't like. And that's what intuition is like, what your body is telling you. And I suppose eating distress and eating disorders are kind of the opposite of what your body's telling you. But you actually forget, you don't even have intuition when you have an eating disorder. Like I let that go. For me, it was like, oh, my body's telling me I'm starving. It doesn't matter, because my brain is the military regime, and it doesn't matter. It's almost like you cut off your body from your brain. Disordered eating is more when you're getting kind of more concerned, where you might have restricted intake to control weight and shape, unresponsive to hunger, fullness cues, eats to regulate emotions or environment, compulsive eating and or overeating, negative body image, limited and or inflexible food intake, all or nothing approach to healthful eating, firm dietary rules, active to burn calories in response to eating, dieting culture. So I think like we're all aware that there is a diet culture out there, and there is a kind of a very, there's an Instagram culture of look at me, look at my body, look at me in this photo, look at me, there's a big culture like that. And I suppose during COVID-19, it was all about healthy eating and exercise and all of this kind of stuff. And that's when things could get a bit disordered, is when you start to restrict your eating. Some people call this orthorexia, where, you become maybe a little bit obsessive, or you start to become more concerned about healthy eating and maybe weighing your food. Your body image might not be, mightn't be good body image or negative body image. I see a lot of teenagers who have a more negative body image and who may engage in more disordered eating, and lots of adults do as well. And then we go to the other end of the spectrum, which is an eating disorder. People can have eating disorders that are undiagnosed because they haven't seen a professional. We'll talk about that in a second, especially in relation to men. But, the names of the eating disorders, the recognized eating disorders in the Diagnostic and Statistical Manual of Mental Disorders, which is what psychiatrists and psychologists use to classify them, are anorexia nervosa, bulimia nervosa, binge eating disorder, and other eating disorders. Okay. So what are the myths about eating disorders? There are many of them, and I've contributed to several articles that discuss them. Eating disorders are a female issue. We're going to find out later that that's absolutely not the case, that eating disorders can occur in men and women, boys and girls. It's estimated that 1 in every 10 cases of an eating disorder is male, while for binge eating disorder it is 1 in every 2 cases. But I think that figure is actually going up, because there is such a thing as muscle dysmorphia, which we'll talk about in a few minutes. And I think that rate has definitely increased during COVID-19 and the pandemic. Eating disorders are a teenage issue. That's absolutely not the case. It can occur at any age from under 10 to over 70. The average age of onset is 15 to 24, which is why I'm talking to you today. And when you think about the life changes that occur during that time, you can understand why this may be the age of onset. But at any age, for some reason, some people can turn to controlling their body and food intake as a way of coping. An eating disorder is a fatty diet. I think I've dispelled this myth already. It's not a type of diet that somebody uses to lose weight. It's actually, like, if you're looking at an eating disorder, it's a serious mental health illness that has mortality rates. And it's a mistake to think that it's just about food and weight. It's about kind of controlling yourself. It's about your sense of yourself, your self-esteem, your self-worth. And again, disordered eating, we said, was in the middle of that spectrum where things start to be of concern. An eating disorder is a lifestyle choice. I think we've debunked that. It's not a choice that somebody makes, and certainly living with an eating disorder is not about, trying to put out a type of lifestyle. You become trapped in that eating disorder. It's almost like an addiction. You feel compelled to do what you're doing in order to feel safe and secure, and it replaces the conscious choice a person has, and they need help and support to be able to choose a different way of living and coping, but it's really hard for them to come out of that. Eating disorders are a cry for attention or someone trying to get through a phase. False. It's not a phase. It's something that a person will grow, or something that a person will grow out of. It's much more serious than that and should be taken as such. And if you have an eating disorder, which kind of, like meets the criteria, and you can, we'll talk about the criteria in a second, you do need medical and professional help for that. Getting better is just a question of eating. An eating disorder is so much more than just about food, so the focus can't all be on food, as you will disarm your child's only coping mechanism. So it's more than that. So I suppose I've kind of, these are certain articles that I've contributed to, and if you look up my name, Malie Coyne, with eating disorders, you'll find a lot out there online on it. I have an interview that I did on the Elaine show. I've appeared in various articles talking about my experience of an eating disorder, anorexia, when I was 14. This article lately, during lockdown, my 11-year-old was hospitalized with an eating disorder, has actually been nominated for a Mental Health Media Award, and the author, Meg Walker, it was an incredible piece by her, and it has so much useful, information on there for parents, family members, people with eating disorders who need support, also some kind of personal stories in there. And I suppose in my own experience, when I was 14, we moved from Los Angeles to Milan in Italy, and I befriended a girl who, I suppose we probably were on the slightly, I don't even like using the word, but not skinny side, right? And she started to lose weight. And because I suppose I'm quite a competitive person, I'm also more quite perfectionistic. I just felt like I'm going to do the same as her. And, what was underlying all of that is that I was really unhappy living in Milan in Italy. I found it hard to get used to yet another country. My sister had moved away. I just felt really quite alone. And for me, this became a focus. And I was like, okay, I'm good at this. I'm good at this losing weight business, So I started restricting my eating, over-exercising, and within the space of 3 months, it became this huge issue. Literally, I'd wake up in the morning and I'd start moving my arms and start kind of marching, exercising. I couldn't stop moving. I hardly ate anything. At lunchtime, I would eat the corner of a piece of sandwich, and it would take me ages. My lips went blue. My hand, I was white all the time. I looked awful. My clothes were hanging off me. I lost my period. I was so unhappy. I was miserable. I joined a gym. I exercised every minute of the day. Some might ask, how was that even possible? But it was, and it happened so fast. And, as I said, it was like a military regime. And, what helped me eventually after a few months, and I was really glad that I was kind of caught early with it. I think it happened so fast. It's almost like, a light was, a flick of a light switch. And, my sister approached me and she kind of recognized the signs, and she said, she saw me hiding my tomatoes under the table during Christmas dinner, and she was, or whatever dinner, and she was like, Malie, really gently said, Malie, what's going on? Why are you hiding your food? And it's tomatoes, it's healthy. And, she wasn't blaming. She didn't disarm me. She was really gentle. She really helped me. And I suppose during the course of the next few months, I started to recover bit by bit and realize that I was dreadfully unhappy and that I needed help. And I did kind of seek the help that I needed, and the support, but it was really hard. It was a hard time in my life. And I suppose it really helps me to, realize how quickly this can happen for young people, and how prone young people are to eating disorders and eating distress, because I suppose our identities are so kind of in limbo. We're still trying to figure out who we are. And then, if you're looking at other people and comparing yourself to others and feeling like you don't quite match up, because I didn't feel like I matched up. particularly, with how you look or how you perceive yourself to look. Because I was looking at myself in the mirror thinking I was fat and I looked ill, So anyway, that was my story, and thankfully I did get help. And if you want to look up any more of what I've talked about before, please do. There are, there's many links out there. And so that was my story. So we're looking at a BodyWise slide here, and BodyWise are the Eating Disorders Association of Ireland, who have a brilliant website and amazing supports out there for young people and their families. And they found a marked increase in the use of their services during the pandemic. And, there still is a huge demand for their services, and they're very closely linked with the National Clinical Programme for Eating Disorders, which is a HSE programme. We'll talk more about BodyWise in a few minutes. But why have eating disorders thrived during COVID-19? Well, I suppose there's a number of reasons for that. A heightened stress and threat around us. So everywhere we looked during COVID-19, and now there's this sense of, when you listen to the news, ever since that day that schools closed and the first lockdown, there's a sense of threat around us. There's stress. There's, if you do this, then this will happen. You need to socially distance. You need to wash your hands, and for an anxious mind, and I have an anxious mind, it really increases your sense of threat. And when you feel threatened as a human being, you need to kind of put some control on that. You feel out of control, so you need to have control. You feel unsafe, you need to feel safe. During the first lockdown and even afterwards, I suppose there was a loss of structure when kids weren't in school or when we were starting to work from home. There was kind of an inconsistency in food routines, where like just food kind of was all over the place. Wherever you looked on social media, there was this focus on food, exercise. And for some people where healthy eating, they had eaten healthy before, it became restricted eating. And for people who were exercising, it became over-exercising. And the issue was that this over-exercising, there were no group activities to do, like there was no more football training and dance rehearsals and all the different things, all the different sports and group activities that young people and young were doing were no longer there. So it became more of an exercising by yourself. Everybody was posting their recipes online or the healthy, whatever they were doing healthy. And that, I suppose, became a difficulty for people to kind of be seeing that. So I guess a lot of emphasis on food, on recipes, on stockpiling food. Increased exposure to negative content can lead to more eating disorder behaviors. Isolation, a lack of usual supports in terms of our friends, in terms of family, access to family members who we couldn't kind of see. And then also school can be a huge support, or college for young people, work environments. And then for people who have an underlying anxiety, they say about 15% of us do, 15%. And then for others, a struggle to regulate emotions, and eating disorders and eating distress can become a way of managing your emotions. For those in recovery, it amplified an already agitated nervous system. So if you were in recovery from an eating disorder, then it just kind of may have aggravated it again. And then you have to always look at the function of eating distress. What is what is underlying? What are the emotions? What's really going on for somebody? So types of eating disorders: anorexia, bulimia, binge eating, and then other specified feeding and eating disorders. So anorexia, many of you will have heard about it. It's a distorted image of your body, irrational fear of becoming fat, feeling worthless, lack of control, constant diet, starving yourself, over-exercise, go to any extent to lose weight or stay thin. You're kind of evaluating yourself based on your weight and shape, and it's usually a body mass index of below 17.5 to be diagnosed as such. That was what I struggled with. And again, my story, which I've already kind of spoken about, is, the battle that I felt, and it was really hard at the time. Bulimia is a cycle of binge eating and purging once a week for 3 months, or, you can have a normal weight when you've bulimia. The first binge, and you consume huge amount of food, you have a lack of control over eating, and you feel guilty. And then your second purge would be to get rid of excessive calories or to compensate, and common behaviors associated would be vomiting, laxative use, exercising excessively, or extreme dieting. Binge eating disorder is compulsive overeating once a week for 3 months, and the person is usually overweight, consuming large amounts of food in short periods of time, unable to stop eating even when really full, does not purge every time they overeat, marked distress following binge eating. And then I suppose to look at common risk factors associated with eating disorders. For internal risk factors, you'd look at genetics, you'd look at more of a tendency towards anxiety or perfectionism, difficulty managing emotions, low self-esteem, body dissatisfaction, extreme or heightened sensitivity to others' emotions or needs. I found that really interesting, actually, because I would say that I do have a heightened sensitivity to people's emotions, and maybe I wasn't only trying to manage my own emotions when I became sick, I was trying to manage my family's emotions and the difficulties maybe we were all experiencing. Onset of puberty, some kids can feel like they don't want to undergo the changes that they're going through, particularly maybe if they've had a trauma in earlier life, and that can trigger. And again, also those identity issues that we have when we're teenagers. Then other factors would be things like social media. Again, that doesn't cause eating disorders, it makes them worse. Traumatic life events can really have an impact. Bullying, family difficulties, abuse, your parents becoming separated, divorced, feeling a lack of support from at home or from your community. As I said, family difficulties, relationship problems, bereavement or loss, abuse, dieting, and a family history of eating disorders. Boys to men, I wrote there. Men are underdiagnosed when it comes to eating disorders. It's under-recognized and undertreated due to the stigma. So probably that's because there's a belief that eating disorders are more of a female problem and an illness. And this is part of the stigma faced by men. It may take some men months or years to acknowledge their experiences as being that of an eating disorder. This can delay help seeking and lead to the illness becoming more entrenched. Some may hide the issue from others due to fear of a negative reaction, being laughed at, judged, or misunderstood. Some men may not seek help until they reach crisis point or following a big deterioration or marked deterioration in their health. Others may recognize the problem more gradually. Isolation amongst men can really affect them, and it can be really common. And I suppose when trying to understand eating disorders in men, certain risk factors are more male orientated. Things like, I suppose, you can have extreme dieting and purging, and that has increased in recent years. But you can also have muscle dysmorphia and other muscle related eating issues. So I'm talking here about the risk factors: muscularity, disordered attitudes and behaviors, men that go to the gym that become maybe obsessed about how their muscles look and their bodies, a focus on muscular leanness, sporadic binge episodes perceived to increase muscularity. So you might binge food to make it look like to make your muscles look bigger, a drive to gain weight in the form of muscularity, overregulation of protein consumption, protein-centric binge episodes, depression and shame, excessive exercise to compensate for eating calories, a runaway diet or muscle dysmorphia, use of steroids and growth hormones. This issue is becoming much bigger in recent years. I did a podcast on the Pat Kenny show. If you search Malie Coyne and Pat Kenny muscle dysmorphia, I actually have it on my website as far as I know as well, drmaliecoyne.ie, if you want to know more about muscle dysmorphia. But please, I suppose anyone with an eating disorder, including men, needs emotional information and social support. If you are a boy or a man watching this right now, or if you are concerned about a boy or man in your life who you think may have type of eating distress, or, their behavior has changed in recent months, they're not socializing as much, they're very focused on the gym and on their muscles and on losing weight or gaining weight, please, I would urge you to seek support or to kind of approach them to help them. And I'll give you the tools for that when I answer a question at the end of this. So this can be a very useful thing to how to tell your own voice and eating disorder voice apart. When we are treating people for eating disorders, it can be helpful to kind of see their own voice and their eating disorder voice as being separate. So the lady that wrote the article, Meg Walker, that I contributed to at the beginning of the year for the Irish Times, she said one of the most helpful things our family was told was to separate the child from the eating disorder. In our case, we chose to give it a name, Julia. So when it's clear that it's not our daughter doing the talking, but the eating disorder, we simply say, Julia is not allowed at the dinner table, or I'm not interested in speaking to Julia, so when you're ready, I'll talk with you. So put simply, the eating disorder voice is a negative form of self-talk or a person's inner critic that is part of the eating disorder. It refers to specific thoughts that are driven by and can maintain the eating disorder. The voice is problematic, distressing, and disruptive. It creates a feeling of helplessness and undermines a person's confidence, and it's difficult for them to trust their own decisions and abilities. So it kind of creates certain rules around eating. It creates a distorted logic and messes with your rational thoughts. It can make promises, threats, and feel as though life is not, without it is not possible. It can reinterpret comments made by others and undermine a person's confidence. It may demand an exclusive relationship with the individual. It can be negative, controlling, and belittling, harsh, loud, critical. It may be experienced as a source of comfort. However, it may rapidly push a person's body and self-control to the extreme. And I suppose that's an important thing to look at. And in terms of dealing with the voice, it can be a significant challenge. Professional support can be effective by developing a positive rapport to help deal with the voice. And families and friends can play a voice. The voice may be present in the background, ready to jeopardize your progress, but actually becoming free of the voice is possible, but it can be a source of stress, and there are ways of doing that. So again, calling it by something, so maybe calling it a name that you don't like, and then, that is your eating disorder self-critical voice. Okay, so you can see in that picture, you've got the devil voice and the angel voice, and you're trying to not tell that voice to go away completely. You're trying to reduce the volume of the voice. So when we look at the causes of eating disorders and why they're more prevalent at the moment, I look at the perfect storm. So even before COVID-19, even before the pandemic, I feel like, our modern lives where we're constantly busy, doing, there can be threat all around us that we feel, I suppose, from social media, from having to be better, do better. And then we have a tricky brain. Our tricky brain is that our brain focuses a lot more on negativity than it does on positivity. So I suppose one thing to kind of be aware of is that, for every positive thought that we have 5 negative thoughts. So our brain attunes more to threat. That's called our negativity bias. So we have to kind of bring more positive thoughts into our brains or generate those in order to counterbalance the negativity. And then there's social comparison theory, where we're much more likely to compare ourselves to others, particularly when we're young people. And that's very normal because you're trying to figure out who you are. And we still do that, by the way, at my ripe old age of 45. But social media makes this worse because you constantly are looking at somebody's highlight reels. I kind of talk maybe about an identity crisis. I suppose the most important process of identity development takes place during our adolescent and years, where we're very prone to comparing ourselves to others and feeling inadequate when this comparison is unfavorable. As a critical and vulnerable time for our social and emotional development, it's often the time where, young people have most access to screens. And I suppose, when you're a young person, no disrespect, but that your brain isn't fully developed until you're in your late 20s. So you are more susceptible to comparing yourself to others, for that comparison to be unfavorable, when you look in the mirror to see what's maybe not really there, to be focusing, you've got that tricky brain focusing more on the one part of your body you're not happy with. When you get older, it's not to say you don't focus on the negative. You still do when you look in the mirror, but it's more like you have perspective. You kind of realize, I suppose I'm a parent as well, and I'm kind of, busy looking after my kids, and you become kind of more busy or more maybe aware of the meaning of life, of what's important, and less maybe self-conscious. But it's completely normal for young people to go through what they're going through. You might be kind of looking at other people going, why don't I look like that? I wonder how many likes I'll get when I put this post up. Why did I get less than the last time? I must have looked fat or not good enough. Or these are completely normal feelings to have as a young person. And I think it's important to share that as much as you can with your friends and family, and to realize you're not alone. You really, really aren't alone. It's part of your brain development and your identity development. Stress can feel more stressful to teenagers. The teen brain is a work in progress, as I said, and it's guided by the emotional amygdala, which are at the back. Your fight or flight response is more likely to guide your brain. Stress increases the activation in your immature prefrontal cortex, which is your rational brain. So in other words, you can't fully activate the more rational brain. You're more guided by your fight or flight response. And that's just the way your brain is when you're a young person. This interferes with your ability maybe to pay attention and to make decisions. So you're more likely to maybe pay more attention to the negative, and it's hard to make decisions sometimes when you're more guided by your stress response. And then there's more of a tendency towards risk taking, reacting from your gut, angry outbursts, hyper awareness of peers. This, we can still have all of this when we get older, but it's just more kind of prominent when you are a teenager or a young person. I can't keep calm. I need you now more than ever. I heard an amazing quote by a psychiatrist a few years ago who said that we overparent our under 10-year-olds and we underparent our over 10-year-olds. So just because our teen tells us to F off, or go away, doesn't mean as a parent we should go away. We might have to parent in a different way. As a teenager, just because you tell somebody go away doesn't necessarily mean you mean that. You might mean it in the moment that you need your space, and that is perfectly okay. But that doesn't mean you don't need help with your emotions. You are going through a massive, rapid period of brain development, and you do need help. If you're in your early 20s, you're still going through a massive period of brain development. All of us, at any age can go through times where we really struggle to manage our emotions if stuff is going on for us. And we need people in our lives, people we love, people that make us feel like ourselves, good people more than ever. So I think when we look at self-care, and I'll talk in a few minutes about, I'll answer some of your questions, but what is self-care? Self-care is a balance of pleasure. So this is anything that brings you pleasure in your life, activities which bring you pleasure. It's a balance of achievement, things that give you a sense of achievement. They don't have to be big achievements. They can be small achievements. They can be, I had set out that I would, go for a walk today, or I would, clear my sock drawer, or whatever it is. And we need closeness and connection. As I said, we are social beings, and we absolutely need that in our lives. So having a combination of pleasure, achievement, and closeness connection is what we need for our daily well-being. When our sense of threat is heightened, we need to bring up our sense of soothing and self-care. That is what we need. Everybody needs this. So I constantly talk about self-care and about, not being able to pour from an empty cup. And I look at a lotus of self-care, about, physical, psychological, emotional, spiritual, and social well-being. I'm so passionate about this. I will be getting a tattoo on my arm with a lotus tomorrow. So yeah, I'm just really passionate about the 5 areas of self-care. If you need me to email you an exercise that will focus on those 5 areas, I would be most happy to do that. Dr. Malie, MALIE COYNE @gmail.com. Please do, or contact me on social media, and I can talk to you more about this lotus of self-care and how you can prioritize various areas in your life, what intentions you can make, because in order to counterbalance that threat, we need to soothe ourselves as human beings. Compassionate self-care, I talk about, again, balancing enjoyment, achievement, connection, making time for daily self-care. Sleep is hugely important. Work-life balance and boundaries. We need boundaries in our lives. We can't be yes people all the time. Being a steward of your senses. If it's upsetting you, if it's making you depressed to look at other people's amazing Instagram feeds, don't do it. Stop. Go for a walk. Read a good book. Talk to your family, ring a friend, do something that's more positive for yourself. I kind of stopped watching the news for a while because I do sometimes when I'm like, oh God, I can't hear more bad news. So you are a steward of your senses. Find ways to cope with stress, focus on what you can control. What do you need right now in this moment? Could be a deep breath. Dedicate me time, commit to yourself, see it through. Have a support network. It's time to befriend your inner critic, and we'll talk about this a little bit more, but we talked about befriending the voice that can be negative inside your head, and we want to turn the volume down on that and turn the volume up on the kinder voice within. So in order to encourage healthy body image, I think this is an important slide for us and if you're a family member or friend, thinking, what messages do I give about how I see myself? So that's important. How do you see yourself? And what messages do you give out about that? How do we talk about other people's body image? Do we talk about them in kind of, in ways that maybe they wouldn't like? How do we talk about our own and other people's body image? Do we say, oh, I'm so this or I'm so that? Do we use black and white statements? I hate this or hate that. I think it's really important for us to kind of look at that. Focusing on our inner beauty and our strength. I think it can help to look at what are the qualities that I have? What do I have that's unique to me? We can forget about that when we're young. We can forget about the things that are special about ourselves because our focus becomes more on how we look and on other people. But what is it about you? What do you enjoy doing that makes you you? I want to know that, focusing on that a little bit more. Maybe, remember we said about the negativity bias, we need to focus more on the things that are good about us. What do people tell you? What would your best friend say are your strengths and your beauty? Normalize the inner bully voice. So we all have this voice that tells us we're not doing well enough, or that, is really mean sometimes. Just accepting that voice is there and realizing you're not alone can be helpful. Focusing on keeping your body healthy rather than kind of looking at restricting your food, restricting and over exercising. And I know if you have an eating disorder, you need a lot more than this in terms of looking at body image, and you may well need GP, if it's very much impacting on your life, you will need help from a GP and, a specialist eating disorder team possibly. But for people who have more eating distress, I would kind of look at focusing on healthy food. How can you keep your body healthy? What does your body need in terms of food every day to keep you healthy? Drinking water, that's another thing. I'll just do it now. I'm feeding my body what it needs. This is what your body needs. It's not just about what your body looks like, but what it does for you. I did an amazing webinar a few months ago with female sports young people that are into sports, and they kind of look what helps them with their body image is that they focus on what their body can do for them in terms of running and jumping and breathing. Even just the simple fact that we breathe every day, that our blood keeps circulating through our vessels. Isn't it just incredible what our body is able to do? The senses, our senses. Even just, kind of taking a few deep breaths and realizing all that your body can do for you. Questioning the reality of social media images. I would kind of say, what you see on social media is not reality. It's filtered reality. It's what somebody has chosen to put up. And the rest of their lives are certainly not equating to that. So please, I suppose, if you need help even from other people to question the reality of social media images, to follow social media accounts that encourage body kind of reality. I don't know about body positivity. I know there's a whole thing about body positivity movement, but, like healthy body image, honing your strengths and also connecting with other people. And then educating yourself is this is what you're doing today. You're educating yourself on eating issues and on eating distress. I cannot overstate the importance of Body Wise as the Eating Disorders Association of Ireland. They are incredible, and they've, very kindly allowed me to use some of these slides. They recognize that eating disorders are not just about food. They don't focus on what people are doing. Their focus is on how people are feeling about what they're doing. It's not just all about food. And this underlies what they do. They've got support services like a helpline, support groups. Bodywise Connect is for 19 and plus. Youth Connect, 13 to 18-year-olds. They've got email support. And they've got this Pillar program, which is a program for families, which is really helpful. They have an amazing website, as you can see there, about eating disorders, body image resources, I need help, supporting someone, recovery treatment, upcoming events, media research. Incredible. They've got resource booklets for parents, GPs on binge eating disorder, pharmacists, dentists, treatment guide. And, they've got lots of information on improving body image as well. And this free Pillar program it's an online program for family members of people with eating disorders. So I very much encourage any contact with Bodywise. I really, really rate them. Another eating disorder app, it's the HSE clinical program for eating disorders have developed an app alongside the College of Psychiatrists in Ireland and Bodywise, which is the national support group. And these three agencies together have created this app, which focuses on, it has helpful information for family and friends, advice about what to say and do, guidance to get help at the right time and place, help on the road to recovery. And it's for anybody who's worried about somebody with an eating disorder or somebody who's going through an eating disorder or eating distress themselves. And you can download the self-care app. It is really worthwhile. And so far, up to the year of, I'm just looking here, in the first year, the app offered regular monthly updates with over 100,000 views. And also just to say that the HSE clinical program for eating disorders are also coming up with community-based specialist eating disorder services. So they've created a number of these teams. There's going to be teams for young people under 18 and then teams for adults. So specialized eating disorder teams around the country, and they are actually coming on stream over the coming years, and there's a number of them already in place. So if you want to look at that, you can look at hse.ie for more information. And finally, I'm going to go through the questions and answers for today. Okay, well, I've had a few questions from people, which I'm going to answer right now. So one of them was, what can I do if I'm worried about a family member or my child who may have an eating disorder? I think, I'm just going to read through some of my answers, which I prepared. I think educating yourself about eating disorders is really important, and that's what you're doing today. Going onto the Bodywise website, reading up on it before you approach somebody is what I would recommend. Don't allow common myths to colour your thinking. We spoke about them already today, and there's many myths out there, and I suppose to be mindful of those. Picking a good time to speak to the person that you're concerned about is important. Give consideration to choosing a place that's conducive as well, and to be able to speak to them in private and without interruption. Be clear about what you're worried about and be honest, and use I statements. So rather than trying to kind of disarm them, you're trying to be calm as you can, and kind of think about how you're going to have the conversation. Tell them you're concerned. Describe what you've observed that is making you concerned. In other words, that, you've noticed that they might have lost weight, that they're off form, they're spending more time in their bedroom. Maybe don't just focus only on the food, I suppose, and try not to disarm them. For me, when my sister came up and spoke to me, thankfully she didn't try to disarm me. But if you immediately kind of say, you better start eating. And I know many parents, it's very natural to want to do that because all your life you've been looking after your child and suddenly you've noticed that they're not eating, and it's, really, really distressing. But I think trying to manage your emotions before you have that conversation is really important. Whatever you can do for that, whether it be talking to a friend or a family member, I think that's really important, because these conversations, your child is going to be defensive because this is their coping mechanism. It's their secret. The last thing they want anybody to disarm them from. It's how they cope with life, Focus on feelings, not just food. So it's really helpful to kind of talk about, that you're concerned about them, what you've noticed in terms of their mood, and not just all about the food. Avoid judgment, criticisms, or ultimatums, being non-judgmental, trying not to say, if you don't start eating, then blah, blah, blah. It's okay if you as a parent have done that already and you're like, oh God, why have I done that? Or I shouldn't have done that. This is your chance to start again. It's okay. We all as parents, I'm a parent too, do things and say things that we're doing this out of threat and out of love for our children. So it can be hard not to be worried and kind of really come out with it with what sounds like a threat. But I suppose, when we're really worried about someone, we can jump to conclusions and think that the other person is thinking the same as we do, which isn't often the case. So because an eating disorder can distort their thinking, it's important to avoid ultimatums. That only breaks down the communication. Tell the person how concerned you are, that you value them, you will be there for them. Don't allow the conversation to deteriorate into an either-or situation. Understand that this is a mental health issue that affects their thoughts, their feelings, their behaviours, which we've spoken about. Be prepared for denial. Very often a person is going to resist any attempt to change or to take away their one coping mechanism. So, understand that you're approaching them in the knowledge that this could be the first conversation of many. You may have to have quite a number of conversations. Change will not occur overnight. It could be 1 step forward, 2 steps back, but recovery is very much possible. Acknowledge you can't change somebody's thoughts. Separate the person from the eating disorder. So when you get to that point, you can say to them, I realize there's 2 sides in your head, the eating disorder and you. And the work of recovery is trying to build up the side of the head, which is not the eating disorder, so that the person will become strong enough to let go of the eating disorder side of their head when they're ready. Ask the person what would be most helpful. So I've noticed this. I really, about your mood or how you're feeling or how you're behaving or whatever it is. I wonder what would be most helpful to you. How can I support you? Accept that an eating disorder is not anyone's fault. Please, as a parent, as a family member, please don't blame yourself. I wouldn't want my parents to blame themselves either. This is just a complex, intertwining, enmeshed piece of, it has happened. So best to be compassionate towards yourself and towards your child. And that early intervention is really important. It's the best chance of recovery for your loved one. The earlier a person with an eating disorder gets help, the better for their physical and emotional help. And there's so many ways of getting help, but I suppose the family GP is often the first port of call. You can look at the Bodywise website, which provides loads of information. And also, your GP will tell you what treatment options are out there and what level of treatment. They will need to do a physical checkup as well, just to let you know, to take bloods and a full medical checkup. Question 2 I had was, how can I help my friend who may have an eating disorder? a lot of what I've just said applies here, but I suppose, show care and empathy, show them you're concerned about them, convey understanding, let your friend know that sometimes people undereat or overeat or try to control their body size because they're unhappy or stressed about something and you want to know more about how they're feeling, okay? Tell them you're worried. Remind your friend that because you care and you want them to be healthy and happy, you want to be supportive, but you're worried about what your friend is doing to himself or herself. Encourage help seeking, encourage them to get help, to talk to a trusted adult, or tell, if you feel like if you're a teenager and you're really concerned about your friend and you don't feel they're going to talk to an adult or they haven't up to now and you've expressed your concern, you may need to talk to an adult yourself about what is the best path forward. It might seem as though you're not being a good friend if you tell someone, but the truth is that getting help with body image concerns or eating problems when they first begin is the best way to help your friend avoid dangerous health problems in the future, even if this might temporarily put a strain on your relationship. But again, ideally, you're talking to your friend initially about your concerns. And I think it's really important to do this. Be a good role model. This means not making negative comments about food or about your own or other people's bodies. We need, as parents even, to stop talking about our bodies in a negative way. Our bodies are all different. They're unique. And, yes, of course, it's fine to, maybe want to increase our healthy eating or, kind of work on how we feel from within. But I think what's really important is that we don't fat shame each other. We talk about bodies in a positive way. Women have babies and our bodies change. And, I just think it's just really important. Like, I'm very conscious about how I talk about my body in front of my kids and about body kind of positivity and promoting health as opposed to complaining or being on a diet all the time or whatever else that is. Question 3, can you ever fully recover from an eating disorder? The answer is yes. Does it ever go away completely? I suppose because recovery includes, behavioral changes and thought changes, it can differ from person to person. The experience of full recovery can be hard to define. It's relatively straightforward when you're looking at more like physical kind of symptoms of eating disorder, but measuring kind of emotional symptoms is harder. How much fear, worry, or distress is the disorder still causing you? Are you still preoccupied with food? So it can be kind of difficult to define that, but some people might say that recovery, it's almost like living fully and authentically, whatever that means to them in regards to food, that they're not kind of obsessed by food anymore, that they can, kind of free themselves of that voice inside their heads. It's possible to recover to the point that the eating disorder no longer affects your life. And, as I said, it can be one step forward, 2 steps back, but there is a way forward with the appropriate help. Early intervention, as I said, is key. I've heard from a psychiatrist lately that for teenagers, for eating disorders, it can take an average of 2 to 5 years to recover. And for adults can be up to 8 years because when they start the recovery journey, because the patterns can become more entrenched in adulthood. The final question is, how can I turn the voice down on my critical voice? As I said, many of us have critical voices. We're grand masters as human beings at beating ourselves up at every opportunity we get, which has huge power over how we feel about ourselves. It's as if we think being harder on ourselves will keep us in line. And being self-critical can be really harmful to our emotional and our physical health because it sends our brain into this fight or flight response. To add insult to injury, when we engage in self-criticism, not only are we the attacked, but we're also the attacker. So we're attacking and we're the attacked, which makes it really exhausting to us. And it can lead to things like depression, anxiety, eating issues. And I suppose the first step to reduce the inner critic's voice over you is to acknowledge its presence, that it is there, and that, we kind of want to, we sometimes talk about befriending our inner critic. And when we befriend that inner critic and acknowledge its presence, we realize that a kinder voice can emerge through, almost like magic. So try it and let me know how you get on. I suppose, one of the ways you can do is, like, say, if you find it hard, what would you say to a close friend if they came to you and they were upset? What would you say to them? What would your kind voice say to them? So we acknowledge the presence of it. We allow a kinder voice to gently break through the surface. And I'm just going to lastly do a self-compassion break with you. So when we hear a negative voice inside our heads, we're going to breathe in through our nose and breathe out through our mouths. We're going to say to ourselves, this is a moment of struggle. This hurts right now. Talking about myself in this way hurts. It's stressful. I'm attacking myself and I'm being attacked. Struggle is a part of life. I'm not alone in this struggle. It's the way it is. Other people feel as I do. Other people talk about themselves negatively. Other people say, for God's sake, why have you eaten that? And look at your body. Look at that body part. I want you to put a hand over your heart and kind of acknowledge that other people feel the same way as you do. Other parents out there are feeling like, why have I done this? Other friends out there are going, why haven't I spoken to my friend about this? This is how it feels when a human being struggles. And lastly, I want you to say to yourself, while definitely putting a hand on your heart, may I be kind to myself in this moment. May I give myself what I need. May I accept myself as I am. May I begin to accept myself as I am. May I forgive myself. May I be patient with myself. And my last slide is, I am beautiful inside and out. And I am telling you here today that you are beautiful inside and out. And although you may not see that right now, I really, really hope that in time that you can acknowledge that for yourself, and that you seek help if you're struggling at the moment, and that if you are worried about somebody who is struggling, that you would please ask, convey your concern to them, educate yourself about this, convey your concern, get support for yourself, and just realize that we're all in the same boat. We all struggle, and the recovery is absolutely possible. Okay, so thank you to Galway Public Libraries for this opportunity to speak about something so close to my heart, about eating distress, eating disorders, and promoting a healthy body image. Please do not hesitate to contact me on drmaliecoyne.ie if you'd like to contact me. And also, I have done lots on social media and online about this before, so feel free to consult with those resources. Contact your GP, consult with BodyWise, and get the help that you need, because you are beautiful inside and out. Bye.